Hey everybody, it's Julia Kavanaugh and
I'm Nancy Ham.
welcome to Postpartum Perspectives, the place to come to hear all things newborn care and postpartum related.
We hope you enjoy the following podcast.
All right, let's dive into this whole newborn care specialist thing.
Okay.
It seems like something that people are really interested in, and we're here to really get into the nitty-gritty.
Yeah.
So we're looking at some notes here from Gentle Ventures,
Okay.
a company that trains NCS professionals, and we're gonna figure out what they do, why they're so in demand, and how come they make the big bucks.
Right.
So first off, what is a newborn care specialist?
So a newborn care specialist, it's a professional, obviously, who has specialized training in all things newborn care.
Okay.
And they have a very broad knowledge base.
Okay.
Breastfeeding, sleep training, being able to recognize ailments, safety, all of that.
So they're kind of like baby whisperers.
Yeah.
With a medical background.
That's a great way to put it, yeah.
Yeah.
They are able to spot things that maybe a less trained eye wouldn't be able to.
Right.
And they not only care for the infant, but they educate and empower the parents.
That makes a lot of sense.
Yeah.
But before we go any further, I feel like we need to clarify
Okay.
all the terms we keep hearing. Doula, night nanny, baby nurse, NCS.
Right.
What is all this?
A lot of overlapping terms.
Yeah.
And there's potential for a lot of confusion. Gentle Ventures actually cautions against using the term baby nurse
Interesting.
because it can have legal implications and is often misused.
So someone saying baby nurse might not actually have the qualifications.
Exactly.
Oh, ew.
Yeah, it can be a very gray area
Got it.
legally and varies from state to state.
Yeah.
So we're going to stick with NCS for clarity.
Good.
So now to differentiate the other roles.
Okay.
So a doula, for instance, provides support throughout pregnancy and postpartum,
Okay.
but their focus is broader than just the baby.
Okay.
So they offer emotional support, breastfeeding guidance, and they even help families to connect with resources.
So they're like a guide for the whole family.
Exactly, yeah. They're
Yeah.
really helping navigate
Okay.
that major life transition. A night nanny, on the other hand, is more focused on the practical aspects of nighttime baby care.
Oh.
So they're there to help parents get some much-needed rest,
Okay.
but they may not have the same level of specialized training as an NCS would.
So they're I don't know, they're there for the night shift.
Right, exactly.
But maybe not equipped to deal with a real difficult situation.
Yeah, that's a key distinction. And NCS brings their own expertise to the
Yeah.
table, and they really develop personalized sleep and feeding strategies for that baby's individual needs and temperament. And they can even tackle those more advanced duties.
Ooh, advanced duties.
Yes.
Now we're talking.
Right.
What are some examples of these advanced duties?
So Gentle Ventures highlights sleep training beyond 3 months,
Okay.
managing reflux,
Mm-hmm.
and working with multiples or premature babies.
Wow.
Those are situations that require a much deeper
Ah.
level of knowledge and experience.
So they're like the Navy SEALs of the baby world.
Yeah, you could say that. They are definitely in high demand,
That makes sense.
which leads us to their compensation.
Ooh, cha-ching. Let's talk money.
All right, are you ready to unpack that aspect?
I am.
Okay, so their expertise is definitely reflected in their rates.
Okay.
The average hourly rate starts around $35 to $50, depending on experience and location, but it can go much higher.
Wow.
Daily rates can exceed $1,000, especially for those handling multiples or infants with specific needs.
Okay, so it's a real investment, but it sounds like a worthwhile one for a lot of families.
It does.
So, say someone is interested in becoming an NCS, where do they even begin?
That's a great question, and Gentle Ventures actually outlines a path for aspiring NCSs.
Okay.
And it starts with an internship program.
So like an apprenticeship
Exactly.
for the baby whisperer.
So the shadow seasoned MCSs gain hands-on experience under supervision, and they gradually transition to independent work.
So there's a whole structure to it
Yes,
to make sure that they're ready.
absolutely. It's all about building those skills and confidence.
I like it.
Yeah.
So to give you a better idea of what an NCS does during those overnight shifts,
Okay.
imagine this.
Okay.
It's 9 p.m. the NCS arrives,
Yeah.
and the first thing they do is have a consultation with the parents,
Yes.
talking about the baby's day, any concerns, going over the plan for the night.
Exactly.
So it's not just about taking over, it's about working together.
It is. It's very much a collaborative approach.
Got it.
And then the NCS will focus on soothing the baby,
Okay.
adhering to the feeding intervals,
Okay.
and just generally ensuring that everybody gets as much rest as possible.
Makes sense.
Yeah.
So besides just getting a good night's sleep,
Yeah.
what are some other reasons why NCS services are in such high demand?
That's a really important question. Let's talk about the reality of newborn care, especially for breastfeeding mothers.
Okay.
You're looking at feeding every 2.5 to 3 hours, and each session lasts around 45 minutes. Add in diaper changes and
Right.
soothing,
Right?
and you're left with maybe 1.5 to 2 hours of fragmented sleep at best.
That's brutal.
It is.
No wonder new parents are so tired.
Exactly. And that chronic sleep deprivation can have serious consequences.
Yeah.
It affects your cognitive function, increases the risk of postpartum mood disorders, and can even strain relationships.
So it sounds like getting an NCS is not just a luxury, it's like an investment in the whole family's well-being.
Precisely.
Cool.
It's about creating a supportive environment where everybody can thrive.
Love it.
Yeah.
Okay, I think this is a good place to take a break,
Sounds good.
and we'll come back and talk more about all this NCS stuff.
Perfect. So we talked about what an NCS is and like why they're so important,
Yeah.
but how do you find a really great one?
Right, because this is like inviting someone into your home
Exactly.
during a really sensitive time.
Mm,
So how do we know we can really trust them?
absolutely. And, you know, that's something that Gentle Ventures really emphasizes.
Ah.
It's about finding an NCS whose philosophy really aligns with your parenting style.
Right.
It's not one size fits all.
Okay.
You know, some families really prioritize that strict sleep training,
Okay.
while others maybe prefer a gentler approach.
So it's finding someone who kind of fits in with your family
Exactly.
and how you want to do things.
Yeah, and that's where experience really comes into play.
Okay.
A seasoned NCS will have encountered
Yeah.
a wider range of situations and personalities. So they have that intuitive sense
Mm.
of what works and what doesn't.
So they've seen it all.
Right.
Okay.
Exactly. We got the battle scars. But that's not to say that newer NCSs aren't valuable.
Right.
They often bring a fresh perspective,
Okay.
and they're up to date on the latest research.
Right. So it's like any job,
Mm,
a mix of experience and new ideas
exactly.
keeps things moving.
Exactly. And, you know, and let's not forget personality.
Right.
You're going to be spending a lot of time with this
Yeah.
person. So finding someone you connect with is so important.
Especially those middle of the night shifts.
Yeah.
When it's just you, the baby, and the NCS.
Exactly.
So where do you find these magical baby whisperers?
Agencies specializing in postpartum care
Okay.
are a great starting point.
Okay.
They usually have a roster of pre-screened NCSs
Okay.
with varying levels of experience and specialties.
So they've kind of already done the background check to
Exactly.
make sure these people are legit.
Absolutely.
Okay.
They handle all the contracts and payments
Mm.
and often those background checks as well.
Right, which is good for peace of mind.
Exactly.
What about like asking around?
Personal recommendations
Yeah.
are so valuable.
Uh,
Hearing about somebody's positive experience firsthand
Mm.
can really put your mind at ease.
right, like getting a review before you buy something.
Exactly. And also, don't underestimate the power of online communities.
Okay.
You know, those Facebook groups and forums.
Yeah.
Even apps dedicated to connecting parents
Okay.
and sharing resources.
So like crowdsourcing your support network.
Yeah.
So agencies, referrals, online,
Mm-hmm.
lots of options.
Yeah.
So once you've got like a potential NCS in mind,
Right.
what are some good questions to ask during that interview?
Well, first and foremost,
Okay.
you really want to delve into their experience and training.
Okay.
You know, don't be afraid to ask about certifications,
Right.
especially those related to newborn care, CPR, first aid.
Yeah, you're trusting this person with your kid.
Absolutely. So safety and expertise are non-negotiable.
Makes sense.
It's also essential to gauge their philosophy
Okay.
on things like sleep training,
Okay.
feeding schedules, soothing techniques.
Right.
Do their approaches align with your beliefs?
Right. Like a mini parenting compatibility test.
Exactly.
Like it.
And don't hesitate to ask about their experience
Okay.
with any specific challenges like reflex multiples or prematurity.
Right.
The more specific your questions,
Okay.
the better you'll understand if they're a good fit.
Gotcha.
Also, you want to discuss things like their availability,
Okay.
preferred shift lengths, flexibility,
Right.
and be upfront about your expectations for the role.
Right, because everyone wants something a little different.
Exactly. So open communication
Yeah.
is key from the beginning.
Makes sense.
And of course, don't forget to discuss compensation
Of course.
and any additional perks,
Okay.
like travel expenses.
So what are some red flags
Uh.
during an interview that might tell you
Yeah.
this isn't the right person?
Lack of transparency
Okay.
or willingness to answer your questions
Absolutely.
openly and honestly.
Okay.
That's a big red flag.
So just like any relationship,
Exactly.
honesty and communication is important.
Exactly.
Got it.
Be wary of anyone who guarantees specific results,
Okay.
especially with sleep training.
Okay.
Every baby is different.
So no promises.
Right. Exactly. It's about setting realistic expectations and understanding that there will be bumps in the road.
Right. Baby's gonna baby.
Exactly. And, and trust your gut.
Yeah.
If their personality or their communication style just doesn't mesh with yours,
Right.
that's okay.
People don't have to force it.
No, it's about finding someone who feels like a true partner
Yeah.
in this newborn journey.
So you found the right NCS. They aced the interview.
Okay.
Now, how do you prepare for their arrival?
It's really like welcoming any guest into your home.
Okay.
So create a comfortable space for them
Okay.
with a dedicated sleeping area,
Mm.
access to a bathroom, any amenities that they might need.
Okay. So they feel welcome
Exactly.
in your house.
Yes. And a clear schedule,
Okay.
outlining the baby's typical routines, feeding times,
Yeah.
and any preferred soothing techniques.
So like a little NCS cheat sheet.
That's a great way to put it.
Okay.
And don't be afraid to over-communicate.
Okay.
The more information they have,
Right.
the better equipped they'll be
Okay.
to provide seamless care.
So like even if you're using a certain swaddle or a sound machine.
Exactly. All those details can make a difference.
Oh, okay. Good to know.
Yeah. And remember, this is a partnership.
Yeah.
Be open to their suggestions
Uh-huh.
and their expertise. They might have insights that you hadn't considered.
Right. So you're taking their advice too.
Exactly.
Got it.
And finally, don't forget to prioritize your own self-care.
Yes.
This is your time to rest, recharge,
Right.
and reconnect with your partner.
Because a happy parent is a good parent.
Exactly.
Okay.
It's about creating that harmonious ecosystem
Right.
where
Yeah.
everybody thrives.
I like it.
I know welcoming a stranger into your home to care for your newborn
Yeah.
can feel really emotionally challenging.
Absolutely. It's a big step.
It is. It's a huge adjustment.
Mm-hmm.
So those feelings of guilt, anxiety, even inadequacy,
Right.
completely normal.
Yeah.
Talking to your partner, a therapist, other parents
Yeah.
who have used an NCS
Okay.
can really provide invaluable support.
So just knowing that you're not alone in this
exactly.
feeling these things.
Yeah. And remember, hiring an NCS doesn't make you any less of a parent.
Right.
It's simply a way to get the support that you need
Yeah.
during this demanding time.
Like calling for backup.
Exactly. You got it.
Okay. So it's not about replacing you.
Mm-hmm.
It's about getting some extra help.
Exactly. You need it. And as you build trust and rapport with your NCS, you'll probably find
Yeah.
that those initial anxieties will fade away
Okay.
and they'll be replaced with a feeling of gratitude and relief.
So taking care of yourself
Mm-hmm.
so you can be a better parent.
Exactly. When parents are well rested
Right.
and supported
Yeah.
and emotionally grounded,
Makes sense.
everybody benefits.
Welcome back. We're wrapping up our NCS deep dive here.
Okay.
And we've, talked about their skills, what
Mhm.
they actually do,
Yeah.
and like how to even find one.
Right.
So now I think it's time to like zoom out a little and see how this whole NCS thing fits into the bigger picture
Yeah, sounds good.
of like postpartum care.
Absolutely.
Jack.
This rising demand we're seeing for NCSs,
Yeah.
it really does point to a growing awareness, I think,
Okay.
of just how demanding newborn care really is
Mm.
and how much parents need support.
Right. It's like we always hear
Yeah.
it takes a village, but
Right.
now people are like actually taking that seriously.
Exactly. It's becoming a practical necessity.
Yeah, not just like a cute saying.
Right. Exactly.
So with this shift in thinking,
Mm.
are we seeing any changes in like
Oh, absolutely.
postpartum care options?
Yeah, we're seeing a whole ecosystem kind of emerge.
Okay.
With NCSs playing a key role alongside doulas,
Okay.
lactation consultants, mental health professionals.
So it's like a whole team.
It is. It's a more holistic approach
Okay.
to postpartum care.
So it's not just about the baby.
Right.
It's about the whole family.
Exactly. It's recognizing that interconnectedness
Right.
of the physical, emotional, and mental well-being
Right.
of both the parents and the baby.
And I imagine that leads to
Absolutely.
better outcomes for everyone.
It creates this ripple effect.
Okay.
When parents feel supported, they can face those challenges
Right.
with more resilience
Makes sense.
and confidence.
And I bet all this is changing the NCS profession too.
You're absolutely right. As the field grows,
Yeah.
I think we can expect to see greater professionalization
Okay.
and standardization,
Okay.
more structured training,
Mm-hmm.
clearer certification pathways,
Okay.
and just greater recognition for the value they bring.
So basically like raising the bar for everyone
Exactly.
and making sure that everyone's getting good quality care.
Absolutely.
So it seems like this whole NCS world is really evolving.
It is. It's an exciting time to be part of
I
this transformation.
I like it.
Yeah.
Well, I think that about covers it for our NCS deep dive.
I think so.
You know, we learned about what they do, how to find them, and like how this all plays into the bigger picture
Exactly.
of postpartum care. And hopefully our listeners now have a better idea of like
Yes.
how to find support after they have a baby.
Absolutely. And, ultimately, there's no shame in asking for help.
Right.
In fact, it's a sign of strength
Exactly.
and wisdom.
I love that.
Yeah.
So embrace the support, explore the resources,
Yes.
and find the right people to help you
Yes.
on this amazing journey.
It's a wild ride, but it's a beautiful one.
That's the truth.
Yes.
All right, thanks for joining us for our NCS deep dive.
Thanks for having me.
We'll see you next time.
See you later.